getting us started. My name is Bill Dempster with 360 Public Affairs, but as often and more importantly, I'm here with the president and CEO of the
iPad
Canadian
download?
Organization for Rare Disorders, Durhan Wan
May
Rieger.
manager.
Um, and yes, once again, please mute yourself and keep your camera off for now. You may get you back on. We're here today to talk about a very important survey for the rare diseases community that's building on others that many of you have participated in the past. But it's much more comprehensive than that, and we're going to make sure that this is used in order to advance the opportunity for rare disease patients and their caregivers to live better lives. Um, I'm going to walk through quickly the panelists we have to explain a little bit more about this opportunity for you and why it's important. I would like to begin, though, by thanking some of the supporters that helped make this survey happen. It wouldn't be possible without the financial support of Alexion Pharmaceuticals, Vertex Canada, especially to be able to communicate and host webinars like this, as well as Rare Eye, Canada's rare disease innovators, with a very important asterisk on that thanks and appreciation, and that is that all of the data that is collected by this survey will be held by and very protected by CORD and only be used by the market research firm that is helping pull this together, as well as selected analysts who are affiliated with universities, including, and special thanks to Rebecca Marsh with the Institute for Health Economics and Professor Deb Marshall with the University of Calgary, who have been excellent in helping us build this protocol and are standing by and prepared to help analyze it. So with that, I am going to turn it over to somebody who needs no more introduction than now. I will give you a quick heads up on who else we have who are going to be coming on the panel, and also letting you know that we're going to keep this webinar much shorter than the time allotted. We booked an hour with you. We're going to get it done within a half an hour, hopefully, because we want you to use the extra time to start the survey if at all possible, because what else is there to do on a beautiful Friday, wherever you are? So the other panelists, after Durhan walks through a little bit on the survey, is Jida El Hajar, a board member of CORD, in fact, vice chair, and executive director of the Lois Dietz Syndrome Foundation. And I know, Gita, you're going to correct me on how I'm pronouncing that. I will get it one day. Oh, that's better. Okay, good. Phew. We've also got Hei-Jin Park, account manager with Ipsos, a globally recognized market research firm. So thank you, Hei-Jin, for all of your work. I know you're going to say that this is one of the biggest most elaborate programming jobs that Ipsos has taken on, but I think it'll go a long way in terms of the outcomes. We're going to get to you with some questions later, and thank you, Hei-Jin, for being available for any questions people have in terms of issues filling it out. But Durhan, why don't you walk us through a few slides in terms of explaining this survey? I'm going to go off camera as well for now.
Okay, so thank you very much, Bill, as always, for making sure that things can be brought forth and helping to present all that we've done. I think for those of you who have been involved with us since the very beginning, I'm going to take us back to about 2003, maybe, some 20, more than 22 years ago, I guess, when the cancer community came out with a huge survey or huge economic information about what the costs of rare diseases were. We have slides. Somebody has slides.
Yeah, I can pull them up, and you can tell me when to push them forward if you'd like. Yeah.
Sure. Okay, thanks. Okay, and we tried at that time to do the same thing, to demonstrate what the costs of rare disease was to Canada, certainly to patients, but more importantly, at that time, what the costs were to the healthcare system and to society. And out of that survey, actually, the cancer community got a huge investment from the government to really focus on. This is the cancer control strategy that eventually came out of it. And we tried to do that. And the company that worked was doing the analytic work for analytics. I think it was called for cancer. Said we can't do it for rare because we don't have any data. You guys don't have any data. I think some of you have heard me say, quite frankly, as far as the hospital system is concerned, as far as most medical systems are kind of concerned, many of us don't exist because we don't have a disease code that is used in the hospitals or used across the healthcare system. So it was impossible for them to pull together that information and to make the case that, in fact, rare diseases was certainly very expensive and challenging for patients, but also for the healthcare system. So some 20 some years later, we are here now to do this survey and to be able to collect the information, and this time directly from the patient and family community to say, what does it cost in terms of living with a rare condition? And what are the challenges you encounter, certainly for people psychologically, from their mental health point of view, socially, for their engagement in the community point of view, but also in terms of the cost of getting access to a diagnosis, getting access to healthcare, and what does it cost the healthcare system then to have patients with rare diseases that are undiagnosed, certainly using healthcare services over and over again without a diagnosis, not knowing what's happening, or even with a diagnosis, not being able to get proper care because we don't have the treatments or we don't have a care pathway. So what we're hoping this will do, thanks to all of you who are participating, we're going to use this information to make the case for investing in a rare disease strategy beyond the drug strategy, but to invest in that whole set of needs for the patient journey. So I'm going to walk you through kind of what this might mean and how we might use it. So hopefully all of you are familiar with NOCORE. We are the network, and this is how it's going out. We're using our rare disease community, but more important, we're asking each one of our member groups and those beyond our member groups to push it to their members. So this is something that is hugely important for us in terms of getting that information directly from patients and families that are affected. Next slide. So this is built on the rare disease drug strategy, as you know. I'm not going to belabor it for those of you who are involved with us, and I'm sure many of you online have been, know that we do have um, the opportunity to have the investment that was made by the national government in terms of funding for rare diseases, but it was directed towards a rare disease drug strategy. And our job has been to make sure that that money is wisely invested beyond drugs. And this is, again, our opportunity to make the case. Why do we need to have investments in screening and diagnosis? Because delayed diagnosis is costly. Why do we need to have investment in terms of specialists? Because if people don't get to a specialist, they are really less likely to get a good diagnosis and get into accurate care. And so this is, again, we're going to be able to demonstrate how hard is it for people to get access to a specialist? What's the impact been in terms of not only their clinical outcomes and in their social and mental health, but also what's the impact in terms of their economic capacity to be able to work or to, if they're parents, to be able to work and care for the family, but also what's the impact in terms of the healthcare system and society at large. So we're going to be able to through our analysis, demonstrate kind of what that impact is. And again, make the case. Yes, we need drugs. We're thrilled to have investment in drugs, but quite frankly, getting to the drugs is equally important. The best use of the drugs and managing and monitoring the drugs are every bit as important. So the data will help us do that. Next slide. I won't belabor this as well. Hopefully, many of you have been involved in this, know that the monies of 1.5 billion, 1.4 of that was negotiated in terms of bilateral agreement. So the monies now are all in the provinces and territories. Everybody's got monies now. They're directed to spend the money on drugs, but as those of you who are with us at the conference in Calgary understand, especially from those who are working inside policy, our goal is to get that monies that is being directed towards drugs and to make a case for the provinces and provide them with solutions about how they can invest that money in terms of the rest of the rare disease care pathway in order to optimize it. So this is something that we want to be able to do. I see questions going into the chat, and I'm really pleased. We'll come back to them. Okay, so that's fine. So this actually fits with our vision of what it is that we said back in 2015 when we proposed a rare disease strategy. What do we need? We need centers of expertise. We need leadership in the patient community and across the patient community in terms of research and specialists. And we've got to have that access to treatment, but it all goes together. So hopefully this survey will provide us with some of that data to help us. Next slide, please. This survey is not being done in isolation. Bill, I think, mentioned some of the sponsors for this survey. And, these are also some of the sponsors that were involved in having and commissioning a survey that was done. Certainly, in the beginning, there's a big U.S. survey. Some of you may have seen the Every Life Foundation survey by the patient community there. Across Europe, the survey was done again, through the group Charles River Associates, and covering, I forgot now how many countries across Europe, not just high income, but also high and middle, low income countries. So again, tease out what's the cost of living with the rare conditions? What is the impact on patients and families? And what is also, quite frankly, the impact in terms of not getting access to timely diagnosis and not getting access to the appropriate treatment. So we're going to be able to, because we're using primarily the same survey questions, we're going to be able to compare Canadian data to European data and to actually look at kind of what we're doing and how other countries are doing. Where does Canada fit in, and where is it that we are also maybe ahead in some things, but also maybe really needing to invest more in certain aspects. So some of the data that's come out of Europe has already been, not surprising for those of us here. What they find is, and they actually were able to compare some of the rare disease. They did the survey so that people with rare diseases were compared with respondents with common diseases. And by the way, I'll just do this quick aside, and Hajian can talk about it. If you have a common condition, as you go through the survey, you will get to a point where it asks you if you have some other common chronic conditions. And if, in fact, you fall into those categories, you too, we're encouraging to fill out the questionnaire, because what we want to be able to do is to make the case for how challenging rare disease is, even compared to very serious chronic conditions. And what they found in the European study was that it takes about a year longer to get a diagnosis if you have a rare disease than if you have a critical common condition. It costs considerably more and definitely harder to get access to the care. So we're also going to be able to take a look at that information, not to say that we think we deserve more than chronic conditions, but that it should not be more difficult to live well, to get access to treatment, to certainly get access to the right care if you have a rare disease. Next slide. So just very quickly, I'll say, what are we trying to problem we're trying to solve with this? There's a lack of integrated comprehensive care for persons living with rare disease across Canada. The survey, as Bill says, conducted by CORT. We will own the data. We have the technical support of Ipsos, and the data is owned by CORT, and the data is de-identified. Okay, next, how will the socioeconomic study data be used? We're going to be using it to actually make the case that I've been talking about before. It's okay, go ahead. And we're going to then tease out some specific things, and maybe Hadrian can help us in terms of understanding how that will be teased out by comparing kind of what's the impact of delayed diagnosis, what's the impact of not having access to supports, including living, far from a center of treatment. How does the socioeconomic data empower the patient community? We're going to return the information back to our partners. We're going to be working with them to help make the case for, and if we have specific, diseases that show up, help them understand kind of what is it their subgroup is saying, and how can they make a better case for getting the resources they need for their subgroup, or at least better identifying the care and support needs of their community. Obviously, the numbers could be very small in some of the subgroups, so we're going to have to work hard to tease that out appropriately. But we want to be able to do is return that information to the patient communities that are participating. Next. So overall, what we want to do then is to build on the fact that we've got, lots of money, or at least the provinces, we got nothing, but the provinces have lots of money, and that we want them to use it appropriately. And we identified sort of three top line goals, but one is to improve screening and diagnosis. Without that, nothing happens. We've already got commitments to newborn screening, but beyond that, there are a lot of diseases not picked up in that. What about genome sequencing? What about targeted awareness around specific diseases? And now we've got AI enhanced platforms that help us more readily identify these diseases. Those of you at our conference heard some of the amazing stuff that around getting dentists to better recognize the potential for a rare disease based on what they could see in terms of patients, teeth, their mouths. Um, Goal two is to build on a hub and spoke model of specialist hub. Getting access to a specialist is important. And then how can these hubs, though, support local delivery and to be able to work with healthcare providers close to the patients? And third, we need to make sure we've got that timely process for getting access to the right medicines and with the ongoing support. So that's our overall sort of three big goals and asks that we will be able to work with the patient communities, work with the provinces to help them be able to understand how investing in these are going to, make for not only better lives for patients, improve the access to healthcare resources, and include certainly the societal impact. And quite frankly, they got monies now. They don't have to spend it on, they don't have to spend some of the drug monies that they were going to be spending it on directly for therapies. Now let's take those monies and use them for improving the system. That may be it. Oh, okay. So this is a brief overview of the survey. I don't know, maybe I should stop here,
Yeah.
Bill, and let
The,
Adrian or you jump in.
This is just what it'll look like when, in terms of the interface of what you're going to see when you log into the survey and some of the initial questions that are going to be requested. There are going to be a fair amount of boxes for you to elaborate on questions. So if you're a fast typer on your handheld, then please do that. But if not, we recommend having access to a keyboard to do it. Um, that said, you can jump on either of these links to be able to get access to it. One's a QR code, and the other is a short URL. And maybe I'll just pause on this screen so that everyone can go and get access to it. It's very high up on Cord's website as well. That's raredisorders.ca. You'll see where you can access it. And yeah, that's a great idea. Hey, Jen, do you want to jump on and maybe explain a bit more about the survey design and how easy it is to get onto it and to take the survey?
Yeah, so thank you, Bill. So we at us at Ipsos here had the honor to partner with Cord to set up this survey, which essentially we are trying to mimic and bring the Canadian perspective on a larger European study on the essentially the price of living with a rare disease. And so some of our questions asked are direct cost questions. So the amount of money that goes into drugs, the travel, any of that, as well as indirect costs. We are also interested in time spent off work, other help from caregivers. So we have a section on that, as well as lastly, the socioeconomic impact of living or being a caregiver of someone with a rare disease. So we do have other questions on the quality of life, as well as just general ratings of healthcare. So it is on the longer side of a survey, but we do hope that you take the time to go through it slowly and give us your input because each data point will be very valuable in the analysis that will be later completed to really do a deep dive on the economic impacts that living or being a caregiver of a person who lives with rare disease or another chronic condition. So that really is our focus. More technical note of this survey link. So it has the ability to remember your device. If you use the same link on the same device and you happen to walk away, you are able to just refresh your page, and it should be able to bring you back to the spot you left off on. But a caveat is it has to also be the same browser. So if you started on Chrome, you should continue and end on Chrome. Right now, our program doesn't really have a set like time limit on this, but based on the average of we have roughly around 70 participants who have already completed the survey, and it's roughly averaging around 40 to 45 minutes for completion. So again, we really thank you for all your time and efforts you're putting in to provide your answers. And yeah, Bill, anything else for me to add?
No, just a point that we worked with you and Ipsos and other analysts and market researchers there to help with earlier surveys that really help describe the diagnostic journey and those challenges. This builds on some of that as well as what we got out of Europe to really go much deeper. And that's why we're asking for a bit more of your time, but we're hopeful that we're going to get up to some response numbers that are similar to what we had in those earlier surveys. We had a few hundred. We're now over 70. We're going to close in on 100, and let's get that up to over 200, 300 if we can. Back to Durhan, your point, many of the folks watching this webinar, and it's going to be available online, are leaders within your own group of rare diseases. Maybe you're an individual patient, maybe you have friends who are, or you're a caregiver. Please take the time to both fill it out. But if you've got a mailing list, if you've got a Facebook page, Cord has a very simple kit that you can download and then push out. We really need to get those numbers up. So that's what we depend on everyone on the line. Thanks, Heijin. I think that's great for now. Geeta, do you want to jump on the line to explain a bit more about the perspectives of patients and the value of this survey for the patients that you lead and that you've led? You've done a lot of work in rare diseases. Geeta?
Yeah, thank you so much, Bill. I actually wanna like say a personal experience that happened to me when we promoted this at the Cord meeting last week, and we were inviting the patients to do the survey. So two patients that were sitting next to me like had a sigh, like finally we're gonna be able to gather that data. And from their perspective, it was like a relief because when they are knocking on doors, everybody asks for this type of data to actually influence, to make a change. You need that data. So that's one of the biggest impact that's going to have, that relief to finally have the evidence so that we can influence change and influence policy. And I really, really invite everyone to do the survey, take the time to do it, because the rare conditions and the rare diseases that we are serving are rare, but they're not invisible, and they're not invisible in terms of the needs and the costs that it is associated with these conditions. And it's the cost is like as Durhan mentioned and Ipsos team mentioned, it's beyond just the hospital bills. It's really how it's impacting your day-to-day life, the caregiving, if you stop working, the travel, all of that. So it's very important that we finally have the evidence so that we can influence policy and change.
Excellent. Thank you so much, Geeta. I also got pulled aside last week separately to just remind people that it's the stories of patients that inform the data which actually shape and drive for policy change. So it really starts with the patient experience and the caregiver experience, and that's actually so many people on the line. And I'm really thrilled with the level of interest, and I think what you're saying is that people feel heard or recognized, whereas before, they didn't. And that's Durhan, I think you've sort of got that reaction as well, dealing with this survey, because I know you helped build a similar one in Europe. Are you hearing similar things?
I am so delighted with all the people that have come up and said, this is what we've been needing, right, to be able to do it. But it's not just the patients. I think you said, Bill, this morning, maybe you'd like to repeat the story. I don't know if you want to tell his name, But you know, way back in 2010, 2014, we were working hard with the federal government to have an orphan drug act, a little different from just a rare disease strategy, but that was our prelude to getting the rare disease strategy. We almost had it. It was pre- completed. It was in front of the parliament, and they never voted on it. But certainly, one of the chief architects from within there, who's certainly one of our heroes within the government towards advancing rare diseases, Bill was explaining the survey to him. And what did he say to you, Bill?
Well, he said if we had had that data back then, he thinks that we would have had a better shot at actually getting it through. So this is just a critical missing piece that we haven't actually brought together in such a comprehensive way, and that he's very hopeful that this will make the difference. And as you said earlier, Durhan, we've got a national strategy for drugs for rare diseases that's from the federal government. We've got CORD's rare disease strategy, national rare disease strategy. And you mentioned cancer earlier, and we talked about it this in Calgary too. The Canadian the Canadian strategy for cancer control, it was actually built by and run by the community. It's stewarded by the Canadian Partnership Against Cancer, but it's the cancer community strategy. And I just think that there's a huge opportunity for CORD strategy to be adopted by reference, to be implemented, and everyone can do their part. And part of that will be provinces that adopt rare disease strategies. Quebec has one, and the federal government saying, yes, we endorse, adopt, and support and CORD's rare disease strategy, and let's get at it. And that's the five pillars, which range from diagnosis, care pathways, research, etc. So we need that full, more comprehensive approach as opposed to just drugs. It's like planning a baseball game and you're just bringing the baseballs. That's a great idea, but we need everyone out there on the field to actually make it happen, and that's what we're hoping for out of this.
Okay,
You
no
knew I was going to
bunting.
have an analogy.
Yeah, but no bunting. Nobody's allowed to bunt. We're trying to hit it outside the park, okay? So you got
That's
to take a
right.
big swing at it. I don't care if you miss. You got to swing. This is what we're trying to do. No, I want to answer a couple quick questions that were raised, and a huge apology. We've got here, and we've had the comment, which is coming into Hillary in our info line, and that is, I've got a rare disease, but I can't answer it because it's not on the list. Huge apologies. We're trying to fix it. I would tell you, it's when the survey was done in Europe, they did it across, I think, some 14 countries. They had 48 rare diseases because they wanted to be able to analyze the survey and have sufficient numbers for each disorder. When we took it on, we said, okay, let's put in 100 of the most common rare diseases, if you can call it that. Um, and then, thought, okay, maybe that would be sufficient. We had another category, but as you will know, if you hit other, it bunts you out. We're trying desperately to fix it. And I know that Agent and her team are working on it. So we are trying to get a fix to it. When we get a fix, we will also broadcast that. So those of you who are on there and trying to get it, we're going to hopefully broadcast and beg your indulgence to come back to the survey because we do want to know. It's just not as easy a technical fix as we thought it would be, but we do apologize. I had thought that might be, sufficient, but obviously it's not. So that's one thing. Second thing, it says, I think there's a question here about secondary disorders. I'm not exactly sure what that means in terms of rare disease as a secondary disorder, secondary to a more common disorder, maybe, not sure. So if you want to write to us into the info line, we'll kind of we can try to respond to what you mean. We do ask a whole lot in terms of what are secondary comorbidities that you may have as a result of, your rare disease or in addition to the rare disease, but it may not be exactly what you're looking for in terms of a response. But happy to try to follow up with you if you want to just drop us a note on that part.
Well, yeah, and the questioner just put it in there, like secondary to the primary, like pernicious anemia, or similar to people taking chemotherapy. It might be drug-induced nausea and vomiting. That would be the secondary, challenge that. And I don't know. Hey, Jin, do you want to jump on to maybe help support on that question? And as I promised earlier, I think we're done the formal sort of presentation. It's now 12:31. If folks are on the line and are able to tag in and actually start the survey, we might even get a few more dozen responses out of today's webinar, which would be great. Tracy, thank you so much for posting the link to the toolkit as well. Now everyone can spread it out in your networks. But Heejin, do you have any thoughts on how to deal with multiple disorders as opposed to just one tag? Do you think that's going to be able to be picked up?
Yeah, so actually the current system actually in Q40, so which is the question asking which of the following diseases you have, we did make it rotate about 2 or 3 times. So if you do have multiple diseases, it does let you know that here, please tell us the one main one that you will be answering most of the questions for. However, it does repeat the question, be like, do you have any other ones you would like to add? I also want to bring attention that we have a section asking about rare diseases, but as well, we have a follow-up question asking about following conditions. So we also have different conditions that do coincide and could be experienced at the same time with a rare disease. So we do have 2 forms and 2 lists of rare disorders or conditions that one might be experiencing.
Yeah. Thanks so much. We've got a few other questions, Durhan, in the chat that are not related to the survey themselves, but I saw that you've been active responding to them. So I don't think I'm going to bring it back into this into the webinar formally, but there's so much that CORE does lead on in terms of these questions about off-label or extremely rare diseases for which you are worried, in many ways, rightfully so, that a manufacturer may not bring a product to market in Canada. And just to let you know that that's one of the purposes of this whole exercise is to bring those voices forward and to push for pathways for access to every treatment that comes available for rare diseases, not just the ones that are going to be coming for the more common rare diseases or the ones that really have a lot of treatments. And we know that there are some that may not be a market here because there's only an N of one. So actually, Durhan, why don't you tackle that? I mean, would these kind of stories help make the case for better special access and better exceptional access in Canada?
We do need to have better repository for some of these stories. I have to think about it. I cannot promise that we can handle stories as part of this survey at the moment. We do know that in Europe, they went back to actually get patient stories, which I think would be tremendously valuable. Let us think about it. I'm thinking that at the time when we have some things that we can start to share in terms of common of diseases, that we really would love to have the patient stories, because numbers are one thing, right? Okay, it took 2.5 hours. I 10 days. I've lost 200 hours of work. Okay, those are just numbers. Now, what does that mean? How does it impact you? And what would happen as a result of that? I think are important things that we need to share, and also some of the resilience. So we need to do that. At the risk of putting the cart before the horse, I just want to say what we did say at the conference, and while Gita's
The
still
only
on
thing
here.
I lost is the computer in my backpack.
You not have lunch before we go?
Yes,
12:30.
Sorry, if somebody's.
I do.
Thank you. Yeah, we're just going to have to mute somebody.
Yeah, that's okay. Yeah. We just want to say quickly is that we are hoping to set up, and we are planning to, we're not hoping to, we will set up a special subgroup for ultra rare conditions because there's so many more of them. And Gita, maybe you can just say a quick word on behalf of Lloyd's Needs as well. Maybe we don't know exactly what we're going to and how we're going to actually organize all of it, but we realize there is a huge need, right?
Absolutely, and it's specifically in ultra rare, the whole diagnostic odyssey is very complicated and complex, and parents and families have to go through so much unnecessary drama to actually get to a final diagnosis. So I think CORD's leadership to focus on that and support ultra rare groups in their advocacy and everything related to improve their outcome is important. So we are now gathering data and information from people interested to be part of that task force, but this is something CORD is going to lead this year.
Well, not CORD's going to lead, Gita's going to, no. look for volunteers. Indeed, it was in the wrong spot in terms of it. No, we're
Excellent.
really thrilled about it, and we're hoping that, this is something that we're seeing, kind of worldwide. So we are 7 minutes over our promised time, Bill. So maybe we can indeed, we'll capture all the questions. If there are some that are unanswered, we will try to respond to them. And I think, as we've all said, we will try to make sure that, if your disease is not on that list, that other category will still allow you to write in a disease and then complete the survey, because we do very much want your responses. So I think this is what we're trying to focus on. And as Jennifer has in there, it's very important. It's not just about treatment. Even for conditions that have treatment, it's so much more than that we need to address. So much
Yeah,
thanks to
excellent.
everybody who joined us.
So yes, this video will be posted on YouTube shortly as soon as it's edited. I've kept this page up because we want people to reach in with their phones and capture that QR code, download the kit, share it in your networks. One person asked if we could send out a note to everyone when the other category is more usable and expandable. We'll do that for everyone in Cord's mailing list. And if you're not on Cord's mailing list, please jump on Cord's website. And depending on how the numbers are looking, if we really have a demand to push this out and push those numbers up, we may be able to play with that June 6th deadline to be able to finish collecting responses. So please do try to get your survey results or input in before June 6th. But we're going to go for quality over timeliness on this one and really get it right. Last word is we're hoping to analyze this over the summer and be able to present it later this year at Cord's conference in Ottawa, which we're circling some dates for right now in November. So in the meantime, yeah, get your input in. This will be absolutely critical for the community. Thank you, Jita. Thank you, Heijin. Thank you, Durhan. Lots of people behind the scenes help pull this together too. Angela, Stephanie, etc. And we'll see you soon. If you have any questions, send them in. We'll stand by to answer them. And this is where you go off, write the survey or put it in your Facebook pages. This is your opportunity to do your part. So thank you so much for participating.